In Dr. Cool's medical practice, he and his colleagues see several Medicare-eligible patients, many of whom have more than one chronic condition. Dr. Cool and his colleagues all care very much about the health and well-being of these patients. But lately, they've started to become concerned about how well they're monitoring this population, specifically when the patients are not being seen in the office. So Dr. Cool decides to call his strategy leader, his Allscripts outcomes executive. He would like to know if there's a possible solution for this, since they do worry about this set of patients, and because meaningful use takes into account unplanned visits to the emergency room. He also knows those visits have been proven more likely as patients get older. Fortunately, Dr. Cool's AOE tells him that Allscripts does have a solution. He tells Dr. Cool that Allscripts has partnered with a company to administer phone calls to patients on a monthly basis, and the benefits of those calls are numerous. Bill tells Dr. Cool that checking in with those patients, many of whom are older, becomes something they end up looking forward to, and that most of them truly appreciate knowing the doctor has someone checking on their healthcare when they're not in the office. Plus, Bill mentions how they can monitor if the person is taking their medications, has health questions of any kind, and can even ensure that they're on track for their scheduled doctor's visits. Bill explains that not only can this be seen as patient care when the patient is not in the office, but he also explains to the doctor that CMS will compensate him based on each patient enrolled. In other words, not only will the doctor have someone checking on the health of his patients when he cannot be with them, the doctor will also be entitled to bill for those calls based on current Medicare rules. Of course, Bill did need to point out that the Allscripts program to administer this currently has no minimums. Bill then goes on to explain to the doctor that Allscripts will roll out the program, produce the paperwork, help arrange for the one initial office visit that CMS requires, and then communicate statuses along the way, all while receiving a percentage of the enrolled. Said another way, Bill says that Allscripts is currently only compensated on the patients they're able to enroll, no minimums. But that is only the current promotion and is subject to change. Dr. Cool thinks about the benefits of someone reaching out to his patients at scheduled intervals when he is not seeing them, and how that would apply to his colleagues' patients too. He then thinks about the potential to enhance his patients' care and well-being. Finally, he thinks about the compensation that he would also be entitled to, so he decides there is simply no downside and agrees to move forward.